The fate of Measure AA is now in the hands of voters here in the Coachella Valley. Hello, I'm John White.
And I'm Karen Devine. Thank you for joining us tonight live at 6. It's Your Vote 2024. Measure AA is on November's ballot around the Coachella Valley.
If approved, it would authorize the Desert Healthcare District to enter into a $646 million 30-year lease to purchase agreement with Tenet Healthcare for Desert Regional Medical Center in Palm Springs. Their current agreement is set to end in 2027.
News Channel 3's Jeff Stahl is digging into the arguments both for and against the measure. All new tonight at 6.
Lease payments of $646 million would lead to the hospital facilities ultimately being owned by Tenet. The question now, is this the best health care solution for the Coachella Valley? The ads are in the mailbox, even hitting your cell phone.
Yes on AA renews Desert Regional's lease, protecting life-saving care throughout the Coachella Valley at no cost to taxpayers. Vote yes on AA.
The California Nurses Association urges a no vote, saying Measure AA would remove local control of Desert Regional Medical Center and prioritize Tenet Healthcare's profits over patients. Deborah Edwards has worked in the hospital's neonatal intensive care unit as a registered nurse for 25 years. She speaks for the California Nurses Association in urging a no vote.
They have not been a good company for us, and there are other options. They want to make us believe that there are no other options, that all the services will just go away, but that's not true.
Edwards argues Desert Regional is not in danger of closing and that Tenet has not reinvested profits into the hospital, leading to structural issues such as elevator problems and plumbing malfunctions. She says Tenet continually understaffs the hospital, jeopardizing patient care, and that there have been cleanliness issues, including a pest infestation that closed a hospital kitchen in February.
There were signs of rats and cockroaches throughout the hospital in the ICU. And that had been for years.
That shouldn't have happened, but it was handled very quickly, and we brought in additional resources to handle it very quickly.
Hospital spokesman Richard Bramhoff says that there are many reasons to vote yes on Measure AA, including Tenet's already demonstrated investments in staffing and facilities. For example, Tenet built the region's only Level 1 trauma center here, brought in upgraded stroke care, and made a $1.8 million donation to double the size of the nursing class at COD. And it's made care upgrades at its other network hospitals, JFK and Indio, also the High Desert Medical Center. It would also cover $220 million in state-mandated seismic retrofitting.
It truly is a win-win situation, and it would be dire consequences if this can't be allowed to continue.
Edwards, opposed, says the sale of Desert Regional would be a loss of a community asset.
Once Tenet has a hold of it and they are allowed to buy the hospital, we no longer, as a community, have oversight.
I work with many nurses, and many are for yes for Measure AA because it is a win-win. It keeps our programs going, and it's no cost to the taxpayer.
Kim Johnson is the hospital's assistant chief nursing officer. She says she's sold on Tenet's commitment to the community now and into the future.
I would never be concerned because what they're going to do is invest into more programs and more higher level of care.
Ultimately, the decision comes down to a belief in Tenet.
I want the community to understand that Tenet Corporation is a for-profit corporation, and that is their bottom line. That is all they really care about.
It's a health system that we need to maintain, and it all can happen at no cost to taxpayers. The alternatives are just not what we want to see.
Now, if approved, that deal will continue the hospital's lease with Tenet beginning in 2027 and include in the sale the El Mirador Surgery Center and Desert Care Network physician clinics. Jeff Stahl, News Channel 3.